Today is that if on your way in from the parking lot today, you found someone collapsed on the sidewalk, what would you do? Call 911. Anything else? Check if they're breathing. Okay. Anything else?
Check for a pulse.
Check for a pulse. Anything else?
An AED.
Get an AED. Morning, John. Those are all really good answers, and there's not a thing wrong with them. We're going to help you to understand how to put all of that in the proper sequence today so that you can be more effective in helping that patient. And so we want to talk a little bit about some simplified anatomy and physiology, what's going on in our body, what's happening when we stop breathing, and that type of thing. And so this is pretty basic, but for some people it kind of gets the idea across simply. And that is, we all know that in order to survive, we have to have circulation. We have to have a means of moving the blood around our system. But more importantly, what's in the blood is what's keeping us alive, and that's the oxygen. So particularly the brain. The brain is very oxygen dependent. And so when we start depriving the brain of oxygen, we start, first of all, acting confused and not normal, and then eventually we'll pass out. But the circulatory system actually consists of two things. There's a plumbing part of it, and then there's an electrical part of it. And some people are kind of surprised to learn that we actually produce electricity in our bodies. But as far as the plumbing aspect of it, we actually have a pump, which you can imagine is our heart. All right, it's about the size of our fist. It sits quite high in our chest, and it's a little bit left of center. And so that pump is like a lot of mechanical pumps. It has valves in it and so on and so forth. And so that pump, if something goes wrong with the valves, you and I can't fix that. That takes a cardiologist. They have to go in and repair some of those valves or replace them. The other part of that plumbing system is the pipelines itself. So as the pump is operating, it has to move that fluid, in this case the blood, has to move it throughout the whole body, and that would be through the pipelines. And the pipelines are the arteries and the veins. The big difference between the two is that arteries take blood away from the heart and they're under pressure. Veins are not under pressure, they're returning blood to the heart. The arteries carry the oxygen and the veins are pretty much oxygen deprived. And so that's the plumbing aspect of our circulatory system. And if we had a problem with the pipelines where they start to clog up with cholesterol and plaque and all those things that are not good for us, then again, we have an issue because we can't fix that. You and I as lay people, we can't clear out those pipelines. That takes a cardiologist again and probably surgery. So it might involve stents, it might be coronary bypass grafts. There could be a couple different ways that they treat this, but the long and the short of it is you and I can't do anything about it. And so we get to the electrical system, which some people are surprised to learn that our body actually will produce electricity under certain conditions, and that is we have to have the proper mix of chemistry. It's all done chemically. Like a battery in our car that uses acid and lead in order to produce an electrical impulse, our body does something very similar, but we use things like sodium and calcium and magnesium, potassium. We get the proper mix of chemicals, and there's a special group of cells in the upper right-hand portion of our heart called the sinoatrial node, or SA node. Some people actually refer to it as an internal pacemaker. This group of cells is the only part of our body where they exist, is in the upper right-hand portion of our heart, and they are designed to take that chemistry, and once that chemistry works together, then it causes these cells to produce an electrical impulse. Why is that important? Well, if I were to take an electrical cord and plug it into the wall over there, and cut the other end of the cord off and just have bare wires, and I came over and touched him on the arm with those bare wires, what would his arm do? It would jump, wouldn't it? It would contract, because that's what a muscle, how it reacts when it's hit with electricity. And it's involuntary. We have no control over it whatsoever. So when we get hit with an electrical impulse, our muscles contract in our body. And so why is that important? Because the heart, this pump, is a muscle. And so if it gets hit with an electrical impulse, it contracts just like every other muscle in our body does. And when it contracts, it squeezes, and whatever fluid is inside that heart gets pushed out, and it goes into the pipelines. Now the pipelines deliver it to the rest of the body. It gets down to every cell that we have. And so as long as that electrical impulse is coming on a regular basis, which is about 70 to 72 times a minute on average when we're just sitting here at rest, that heart will keep going like this. Every time it gets hit with an impulse, it's going to squeeze, it's going to contract, and it's going to push the blood out. Then it relaxes, the blood fills back up again. It gets another electrical impulse, squeezes and pushes the blood out, relaxes again, and so on, to the tune of about 3.5 billion pumps in a lifetime. That's a lot of action. That's a lot of work. And so if we take away the electrical impulses, the heart just sits there and does nothing. It's the same thing as if we don't move our arm, that bicep will just sit there and does nothing. It's not until we take action with it that it starts to contract. And it's the same thing with the heart muscle. It will not squeeze until it's hit with an electrical impulse. So if something goes haywire with that electrical impulse, the heart cannot beat any longer. And we're in a serious problem. And so the good news is that if it's an electrical problem, we may be able to fix that by use of that defibrillator hanging on the wall. And so let's talk about how that works. When we go into sudden cardiac arrest, a couple things are going to happen. But before we start that, let me ask you a question. Does anybody know the difference between a heart attack and a sudden cardiac arrest? Probably not. When I say heart attack, what age group do you associate that with? Older folks, right? Our age, right? How many times have you ever heard of an elementary school kid having a heart attack? No. Or even a teenager having a heart attack? It very, very seldom ever happens, and it's usually because they were born with a congenital heart disease. And so heart attacks are something that happen usually to us older folks. And it's because we have a plumbing problem. What did I say the plumbing problem, plumbing was? Well, it consisted of the pump, the heart. So now as we age, those valves, there's 4 valves in the heart, those valves might be wearing out just through age and through use. And so they may have to be replaced or repaired. And so, again, if it was a plumbing problem, you and I can't fix that. Same thing with the pipelines. If they start to get clogged up with cholesterol and plaque and all the things that, after a lifetime of eating the things that we maybe should not have been eating, and it build up on the inside of our arteries, again, we can't fix that because it takes a surgeon to go in and actually put a stent in to open up those arteries again, or maybe do a coronary bypass graft. And so if it's a plumbing problem, that's what causes a heart attack. Now, when a person has a heart attack, most of the time, the vast majority of the time, they're alert, they're awake, and they are able to communicate with us. If I say that when I talk about heart attack, what do you associate as far as symptoms? How would you think, why would you think someone might be having a heart attack? Chest pain.
And down into the arm.
Yeah, down into the arm, most of the time on the left side, but not always.
Yeah.
I'm sorry?
That's the side the heart is.
Yeah. So oftentimes it's on the left and sometimes on the right, but most often on the left. What else do you associate?
Back pain too, in the shoulders and the back.
Yeah, back, shoulders. Anything else? Nauseous. And sweating, that's called diaphoresis. Yeah, sweating. What else? Jaw, yeah, we get numbness in our jaw. Anything else? Ladies, pay attention. This one's for you. You feel a lot of indigestion, okay, like heartburn, and you think that you have indigestion, and it's because you think it's because of the meal that I ate. Pay attention to that, because for you ladies, that could be a sign of a heart attack. Men, not so much. Men usually experience the crushing chest pain, shortness of breath, diaphoresis, that's sweating, and again, the things that we talked about, numbness in the arm, in the jaw, back pain, nauseousness, and you ladies may experience some of that too, but pay attention to that indigestion, okay, because that's a frequent sign for ladies. And so, again, when we have a heart, yes, sir?
Can you tell me why a woman would experience that indigestion?
Anatomy.
What's
I don't really know.
okay.
Yeah, but I just...
The medical folks don't know, but they know that's
It,
an indicator.
it's more prevalent in females than it is in males, okay? Why, we really don't know.
I mean, when you associate it with the heart, it just seems a little bit
Yep, I agree with you.
outside the norm.
I agree with you. I think they're tougher myself. I think,
Is that why doctors suggest don't be taking Tums and stuff all the time, because you may be having a problem? with
that's
your heart?
correct, because especially like if you're in your 20s or 30s and you think you're having indigestion, okay, maybe try some Tums. Up in our age, you might want to get it checked out real quick, because it may not be. And believe me, the hospital would rather have you come and visit them and say, no, you're fine, and send you home, than to find out later that you came in by ambulance and they're doing CPR on you, okay? So most of the time, the vast majority of the times, when people experience a heart attack, they're conscious and alert, and they're experiencing these symptoms that we talked about. The difference with heart attack and sudden cardiac arrest is that sudden cardiac arrest can happen to anybody at any time, at any age group, and it comes without warning. There are no symptoms for sudden cardiac arrest. Now, it's possible that a heart attack, because you're under so much pain, shortness of breath, and all the other things, it's possible that you could experience sudden cardiac arrest because of the heart attack, but sudden cardiac arrest usually comes without any warning whatsoever. And again, it can be younger people, it can be elderly, it could be anywhere in between. It happens to anybody. How many times have you ever heard of perhaps a Little League baseball player that went down on the field after he got hit in the chest with a ball or a bat or something, and now they ended up having to do CPR on him? Well, he was in sudden cardiac arrest, and that was due to trauma to the heart. How many football fans do I have in here? How about the Buffalo Bills player, Hamlin?
Yeah.
A couple of years ago, he was a linebacker. He tackled another player, went to the ground. When he tackled the other guy, the other player's shoulder hit him in the chest, got him down to the ground. He stood back up again and collapsed. And the next thing you know, they're doing CPR. They've got a defibrillator on him and everything else. He was 23 years old. He is. He was 23 years old. And yet he had sudden cardiac arrest. Probably one of the most healthy people on the planet. But he had sudden cardiac arrest at 23 years old. Why was that? Again, trauma. As a matter of fact, that's exactly what happened to him. It's a condition called commotio cordis. And that little red area on the right-hand side, that little 40 millisecond area, if you get hit in the heart during that part of your heartbeat, and that's what that is from an EKG graph, That's one heartbeat, that whole line there. But if you get hit in the chest on the heart during that 40 millisecond period, your heart will stop. And that's exactly what happened to this football player. He got hit in the chest during that 40 millisecond period, and so he went into sudden cardiac arrest. So anybody can experience sudden cardiac arrest. Now, think about, you've probably heard stories on the news where, especially here in Florida, we have high schoolers that in the summertime, they're running up and down the football field, and they're practicing football, training for football. And we had, back a few years ago, there was a 17-year-old that collapsed on the field when he was doing wind sprints. He collapsed on the field. He didn't get hit. It wasn't like this Buffalo Bills player that got hit in the chest. He was just running wind sprints up and down the field. He had a different kind of an issue, but he still went into sudden cardiac arrest. In the heat of the summer, what do you suppose is happening to us? We're sweating like crazy. When we are sweating, we're giving off electrolytes. With that perspiration, we're giving off these chemicals that are used to generate an electrical impulse in our heart. So we're losing sodium, we're losing potassium, we're losing magnesium, we're losing all these things that the heart needs in order to produce an electrical impulse. Well, when we get those chemicals out of balance and we're not supplying the chemicals to that sinoatrial node, it can't produce an electrical impulse. And if it can't do that, the heart stops beating. And so here's this 17-year-old, he collapses on the field, and they end up doing CPR and defibrillating him and everything else to bring him back. Again, he didn't have a heart attack, had nothing to do with a heart attack, but he did go into sudden cardiac arrest. And we've had similar stories with college basketball players and so on. And so it's not something just for old people. This happens to all age groups, and it doesn't necessarily mean that there's a plumbing problem and our pipelines are clogged up, or it doesn't have anything to do with that. It's all because the electrical impulse was interrupted for some reason or another. And so sudden cardiac arrest can really happen to anybody at any time, at any age group. And it's not the same as a heart attack. Yes, ma'am.
So is there a symptom? Is because it's sudden, do they not feel anything?
I have no idea it's coming. There's no warning sign whatsoever. A heart attack, we talked about all the symptoms of a heart attack, and like I said earlier, a heart attack can lead to a sudden cardiac arrest. So that would be the only warning in that case. But in the cases of, the little leaguer getting hit in the chest, he had no symptoms. He had nothing happening until he got hit in the chest with either a ball or a bat or something, or the football player, etc. There's no symptoms. Now, the athlete that's running up and down the field and he's becoming dehydrated, he probably felt some other symptoms. He was probably headachy from lack of hydration and that type of thing. So he may have felt something. But most of the time, because they call it sudden cardiac arrest, we don't know that it's coming. Any other questions? All right. So that was our commotio cordis. So what happens when we go into sudden cardiac arrest? Well, first of all, that electrical impulse that's causing our heart to contract, that stops. That electrical impulse is no longer causing our heart to contract. And so that electrical impulse, instead of coming 70 to 72 times every minute, it becomes very disorganized, and it may not produce any electrical rhythm whatsoever. When I was an EKG technician and went to school, we had to memorize 86 different heart rhythms. In other words, we had to look at that graph paper with heartbeats on it, and we had to interpret that, and we had to memorize 86 different heart rhythms. Out of those 86 different heart rhythms, only 2 of them were shockable. Only 2 of them could be fixed with a defibrillator. The other 84 rhythms, the only thing that we could do is CPR. And so it's important that we recognize what's going on here. The electrical impulses become disorganized, and therefore no contraction is taking place. Without the electrical stimulus, we lose that mechanical action. We need to have the electrical impulses in order to create mechanical action in the heart. And when that happens, the heart actually goes into a condition called ventricular fibrillation. And that's where the heart, instead of contracting like this, the heart is actually just quivering. And so it's ventricular fibrillation in 90% of the cases. The other 10% of the cases, it's a condition called ventricular tachycardia. Tachy means fast. Brady means slow. So tachycardia means a fast heart rate. Bradycardia would be the opposite, a slow heart rate. And so in ventricular tachycardia, which is 10% of the cases, the heart is beating so fast, in other words, the electrical impulses are still coming, but they've gone chaotic. And now the heart is beating so fast it doesn't even have a chance to refill with blood before it squeezes again. So the pump is functioning, but it's running dry. There's no blood in there to pump back out again because it's pumping too fast. Normally, like I say, when we're sitting here at rest, we're around 70 beats a minute. In some cases, in ventricular tachycardia, it'll go up to 280 beats a minute. And you can imagine the heart is just pumping so fast it can't even have a chance to refill with blood before it squeezes again. So it's just like running a dry pump.
Is that something that then would cause a heart attack because it's working so fast that the heart just...
No, it wouldn't cause a heart attack because that's a plumbing issue, okay? This is an electrical problem, so it doesn't cause a heart attack. It does cause sudden cardiac arrest, okay? So the thing that we can remember, and the good part about this, is that we don't care whether it's ventricular fibrillation or ventricular tachycardia. The treatment is the same. Use a defibrillator. Okay, we don't have to figure it out. The machine does all of that for us. And so just think about that idea of ventricular fibrillation. What did I call that machine hanging on the wall? A defibrillator. In other words, fibrillation is the heart's quivering. That machine is a dequivering machine, if you think of it that way. It's going to stop the heart from quivering. How does it do that? Well, first of all, when we do have a sudden cardiac arrest, the blood flow stops because obviously the heart's not pumping anymore, so the blood stops, and the blood is carrying the oxygen. And the oxygen is what's keeping our brain going. Without the oxygen, we lose consciousness very quickly. When we lose consciousness, we also lose something else, and that's called breathing. Because in the base of our brain is an area called the medulla oblongata, and it's a primitive part of the brain, and it actually is responsible for causing us to breathe. It's our breathing center. A lot of people think the breathing center is in our lungs. It's not, it's in our brain. And what happens with the medulla oblongata is it measures the amount of carbon dioxide that's in our bloodstream. And when the carbon dioxide levels get too high, it says, breathe, dummy. So that brain is what's causing us to take a breath because the carbon dioxide levels have gotten up. And so the victim loses consciousness because they're not getting this adequate supply of oxygen coming to the brain. And when they go unconscious, they also will stop breathing. The bad thing is that when we stop breathing and we have no more oxygen reaching the brain cells start to die in 4 to 6 minutes. 4 to 6 minutes. So here's a question for you. We walk into the restroom, we find someone laying on the floor, we check them, they're not breathing. Is that an emergency? Yeah. Okay, so our next action should be to call 911, right? Because we want the professionals to get here with all their equipment and all their drugs and everything else. We want them here as fast as possible. How long is it going to take them to get here?
Longer than 4 to 6 minutes.
Longer than 4 to 6 minutes. Any other thoughts? Well, let me share a personal story with you then. I was, like I mentioned earlier, I was a Citizens on Patrol volunteer, and 4 years ago, Groundhog's Day, I was on patrol, and I went to Pear Park right across the street. And I pulled into the fire parking lot down by the softball field, and there was a guy changing a tire on his car. He was the only one down there. There was no one else around. So I pulled up to see if I could give him a hand. And before I even got the car stopped, he went face down in the dirt. So I stopped the car, jumped out, left the car running, left the door open, ran over to him. I rolled him up onto his back. He was not breathing, and he was unresponsive. And so I started CPR. So I got some compressions done, and then I wanted to get my face mask out of my medical bag, which was in the back seat of the car. So I ran and grabbed my medical bag, and I also grabbed my portable radio. And instead of calling 911 on my cell phone, I called them on the radio, direct to dispatch. And I said, there's a man down, CPR is in progress. I'm at Pear Park, right across the street from Legacy. Send an ambulance. And so it was dispatched, and I went back to working on the patient. The next person that pulled up was his wife. When he had problems with the tire, he must have called home to her and said, bring me these tools or whatever. And so when she arrived, I'm doing CPR on her husband. And anyway, the next person that showed up was a deputy sheriff. He heard the call over the radio. He happened to be in the local area, so he pulled in to see if he could help. And by this time, I had been working on the patient for 12 minutes.
And you were probably very tired.
I was about worn out. 90 degrees, 70 years old. I was shot, okay? So he said, how can I help? And I said, do you have a defibrillator? And he said, no. I said, then you can take over for me doing CPR. So he did. A minute after that, here come a fire battalion chief that also heard the call over the radio. He came by and he said, how can I help? I said, do you have a defibrillator? No, I don't. Go help him with CPR. A minute after that, here came the fire trucks. So now it's 15 minutes into the call. The fire truck came, they had paramedics, they had defibrillator, they had cardiac medications, they had everything that was needed, and they took over. They shocked him 4 times, they got a pulse back, and now they need to get him to the emergency room, but they can't take him in the fire truck. So we're waiting for the ambulance. Where's the ambulance? So we called on the radio again, where's the ambulance? Well, they're having a hard time finding you. I said, well, it's in Pear Park. It's off of 27. It's right across from the entrance to Legacy. And they said, and the deputy said, why don't you take your squad car out to the front entrance, turn your lights on, and then maybe when they're driving up and down, they'll spot it. And sure enough, a couple minutes later, they found us, and we took them back there, and they transported them to the hospital. But that was like a full 17 minutes, 18 minutes after the initial call went in. But it was 12 minutes before anybody showed up. And I was there alone for 12 minutes. So here's the question. If no one had been doing CPR on him for that 12-minute period, what are his chances of surviving?
Zip.
Here's a graph that'll tell you. For every minute that goes by without oxygen reaching the brain, your chances of survival drop by 10% per minute. Per minute. Okay, so 12 minutes, his chances of surviving are next to nothing. And the next question is, if we do revive him, what's going to be the state of his brain? Is he going to be a vegetable? Brian?
Hopefully I'm not jumping the gun. Did he survive, Bill?
He did not. He did not. His wife told me that he had 2 prior heart attacks, and when I was doing chest compressions, I could tell that he had had open heart surgery. So he had a real bad history of cardiac to begin with. Well, because he had a zipper on his chest about that long.
I thought maybe
Well, I could tell that too. Because one of the things that you'll find whenever you start doing chest compressions, except on the very young, you'll almost always do some sort of injury to the patient. It goes without saying, it's just part of the territory. When you think about it, when we're pressing on the chest, there's cartilage, there's intercostal muscles in between our ribs. We're pressing the ribs down, we're stretching all those muscles, the ribs themselves, so there's the possibility for causing all kinds of different injuries. But guess what? They're dead. They're already dead. And so if you don't do any of those things, they're not going to be deader. You're not going to make them any deader, okay? So time is critical. We need to get onto this immediately. Now, if the only thing that we start doing is chest compressions, how much time do we have? At least 4 minutes, right? Because we can circulate the oxygen that's still left in the bloodstream. If we can at least compress the chest for 4 minutes, we're going to keep feeding oxygen to the brain. That's going to keep the patient going. So that's better than doing nothing at all. So what is called cardiopulmonary resuscitation? Well, sometimes people get discouraged when they hear this, but only about 7% of the people that receive CPR and no other treatment, only about 7% of them survive, which is a pretty low percentage. So then the question arises, well, why even bother to do it then if it's that low? Well, what you have to remember is that CPR doesn't by itself save a lot of people. What CPR is designed to do is keep the patient viable until more definitive means can show up. In other words, when somebody brings that defibrillator to us, or a paramedic comes by and has cardiac medication. That's the reason why we do CPR, is to keep that brain viable until those other things come onto the scene and can help the patient. But CPR in and of itself does not bring a lot of people, revive a lot of people, yes.
In other words, how long can you, what's the time frame?
Well, ideally, what the medical community wants to see is from time of onset to time of the defibrillator being applied, 90 seconds.
Really?
That's the ideal.
A minute and a half?
A minute and a half. That's the ideal, okay?
What would,
Well, it would be like if you were on an ambulance and you arrived with all of your equipment and you go to treat the patient, from the time you touch them to the time you shock them should be 90 seconds or less, okay? I'm sorry?
I understand.
Anyway, if we introduce a defibrillator, instead of just doing CPR, if we use a defibrillator, then survival rates jump up to as much as 74%. So it's a big deal, you know, to get that defibrillator, use that defibrillator. So what happens during defibrillation? Well, if you look on the slide here, you'll see that there's 2 electrodes, those white patches that are on the chest. Those are the electrodes from the defibrillator. So we put one way up here on the right-hand side underneath the collarbone, and we put the other one down here underneath the armpit on the lower left ribs. Excuse me. And what happens is this electrode that's up on the top, it sends out a signal looking for the other patch. This is called biphasic. Years ago when they first brought these in the field, we had monophasic. And so when you discharge the shock, discharge the electricity, it went all over everywhere. With biphasic, it's much safer because it's looking for, one patch is looking for the other patch. And once it senses it, which is done in a split second, once it senses it, it sends the shock out to the other patch. Well, what's in between? The heart. And that's how the heart receives that shock. Now, we have had cases where we had a patient that was trapped in the car. He had a car wreck, and he was in cardiac arrest. And we were cutting him out of the car with the jaws of life. and we could not get to the proper areas to put the patches in the right spot. So what we ended up doing was putting one over top of his heart and the other one on his back, directly opposite. And when you punch the shock button, it just travels through to the other patch, and the heart's in between, so it received the shock. As a matter of fact, that's now what's recommended for children. When you have a child patient and you're going to defibrillate them, they recommend putting a patch on the front and on the back. But
Do that for children? What age is are they, when you say from children to adults, we're doing something like that?
you can use a defibrillator on any age.
I mean, when you put it over the chest to the back,
Well,
you say it's recommended for children.
yeah, they say that a child is actually from 1 year old up to 8. That's what they consider a child. From 8 and above, that's what they consider using it as an adult. But let me give you another true life case, okay? When I was doing my, we had an evolution that we had to do, a rotation that we had to do in the hospital with psychiatric patients. So I was at Niagara Falls Memorial Hospital, and the police called us and they said, we have a person we want you to evaluate. We just arrested him, brought him in, but we want you to evaluate him. And so they brought this guy in. He's like 6'2", and he's 250 pounds. And the nurse hands me the chart, and she says, okay, you're going to go in and interview him. I said, thanks very much. He's in handcuffs, right? And of course, they had a guard standing outside, so it was not, but I was in the room by myself with him. And so I started questioning this guy, and I said, let's get some basic information. Let me get your name and age and all that stuff. Well, he gave me his birth date, and I said, could you tell me that again? I think I misheard what you were saying. He was 12 years old. 12 years old, 6'2" and 250 pounds, and he was 12 years old. Now the question is, do I treat him like a child or do I treat him like an adult? Physically, I have to treat him like an adult. Mentally, I have to treat him like a child. And so I've always recommended to any of the students that when you're dealing with your patient, look at them physically first and treat them based on their physical size, because an 8-year-old could be the same size as an adult. And likewise, you might have somebody that's 90 years old and they're 4 foot nothing and they weigh 80 pounds. Do you treat them like a child or do you treat them like someone my size? So don't necessarily go by age because it can be misleading sometimes, okay? So when we do defibrillation, what happens is that shock runs from one patch to the other and it hits the heart. Well, what does it do when it hits the heart? Well, unlike what most people think, like when we have a weak battery in our car and it's not enough juice to get the car started, what do we do with it? We hook it up to a good battery. We boost it. We get another car over there that's got a good battery, and we hook up the cables and we feed some of the juice from the good battery to the bad battery. And we bring up the level of the bad battery so that we've got enough juice to actually get the car started. In defibrillation, it works exactly the opposite of what you'd expect. We are not trying to boost the heart, we're trying to stop the heart. We want to shut it down completely. Because remember what's happening. The electrical impulses in the heart are going haywire. So they're either in ventricular fibrillation or in ventricular tachycardia. So there are electrical impulses there, but they're not the proper ones. And so what happens is we have to stop that electrical energy. We have to shut it down completely. And the way I like to compare it to is when we have a problem with our computer, what do we do with it? We try this, we try that, and we end up shutting it down, right? Control, Alt, Delete, shut it down. And we turn the power off. And we wait a few minutes, and then we turn the power back on again. Well, that's exactly what's happening with defibrillation. We're shutting all of the power down in the heart by stunning it. We hit it with 360 joules of energy, which is I don't know what a joule stands for, but I just know it can hurt you.
It's a lot, right?
It's a lot. And I've got a story about that too. But it's designed to stop the heart, stun it to the point where that little SA node, that internal pacemaker, shuts down completely, and then it has a chance to reorganize, and hopefully, when the chemistry is right, hopefully when it comes back, it starts firing at 70 to 72 times a minute. That's what the hope is. That's what a defibrillator is designed to do. Stop the heart, give it a chance to start up again on its own. And most people think, well, I'm just going to give it a little extra energy to help it get going again. No, that's not what happens. It's designed to shut it down. How much is 360 joules? Well, Lorianne and I were on a call. I was driving the ambulance that day. She was treating the patient. We loaded him in the back of the ambulance. In the process of treating him, he went into sudden cardiac arrest. Lorianne grabbed the defibrillator, which in those days we didn't have these nice patches. We had the paddles. And so we had to squirt some conductive gel on the paddles, rub the paddles together to spread the gel around. And when she did that, some of that gel came out and hit her on the wrist. And then she put the paddles on his chest. She punched the shock button, and some of that electricity jumped over and hit that conductive gel. And she got shocked, and it knocked her right across the other side of the ambulance. And she yelled out, she said, "Bill, you got to come back here." And I said, "What's going on?" "I just got shocked." And I said, "Okay." So we ran around, I traded places, and now I got a full cardiac arrest that I'm working with, and she's got to get us to the hospital, and I'm dealing with him, and all the time I'm thinking, are we going to make it to the hospital? Because I don't know what it did to her. Fortunately, she was 36 years old and in good health, but she did spend the rest of the day in ICU under observation. So remember, it's designed to stop your heart. Even if you're healthy, it's designed to stop your heart. And so she probably had her heart stopped momentarily, and then it started right back up again, but it can hurt you. That's what it's designed to do, is to stop your heart. So it's not what most people think. It's just the opposite. It doesn't boost it, it shuts it down. And so that's what defibrillation is designed to do.